Hello. In today's presentation, we will speak about the fourth point on the liver channel, Liv-4. The name of this point is zhōng fēng. Zhōng is central in the middle, and fēng refers to an envelope, a wrapper. The name has to do with the point's location and the needling technique. We needle it under the tendon towards stomach 41 point. Thus, figuratively speaking, we are putting the needle into an envelope. An alternative name for this point is chuan, suspended spring, another anatomical inference. Liv-4 manifests hexagram 16 on the liver channel. The name of this hexagram is U, satisfaction, freedom from restraint. Its inner, lower trigram is kun, field, which is characterized by D, soil, and belongs to yin, earth. And its outer, upper trigram is zhēng, that belongs to yang, wood, and has characteristics of lei, thunder. The inner trigram in this hexagram represents the energy of the earth, and the outer represents the energy of the thunder. Hence, we have the image of unrestrained activity that manifests from within to the outside world. This activity meets no opposition, thus satisfaction and freedom from restraint. Yet, this energy has to limit itself to avoid chaos. Liv-4 spreads pathogenic qi in the liver channel. It primarily rules the lower abdomen and the genital region. As a Jing river point, Liv-4 has metal correspondence. Thus, it relates to the lung organ. Collectively, Jing river points on the yin channels treat lung-related pathology, such as panting or coughing, chills, fever, and diseases with sound change, because lungs and metal are associated with the sound. In terms of its lung connection, Liv-4 is a handy point for spring seasonal external pathogenic factor with runny nose, sneezing, and seasonal allergies. Additionally, Liv-4 treats jaundice and malaria, especially when accompanied by a low-grade fever. Jaundice with periodic low-grade fever is treated by combination of Liv-4 and Liv-10. And we can also use Liv-4 for the treatment of acute hepatitis. For this treatment, we combine Liv-4 with large intestine 4, a source point in the large intestine channel, and the large intestine 11, an earth point. So we are treating damp heat in the liver and also heat in the large intestine channels. Another combination for the treatment of hepatitis is we can use back shoe points of the liver and the gallbladder, bladder 18 and bladder 19, and then we can use front mu point of the spleen and the liver channel, liver 14 and liver 13, and the He point of the stomach channel, stomach 36, true earth point, to obviously also dry dampness. As a metal point on the channel that belongs to the wood phase, Liv-4 regulates excessive qi in the liver channel. It has a therapeutic effect on the genitals, urinary system, intestines, and abdomen. Above the diaphragm, Liv-4 opens the chest to treat sighing and influences the throat and esophageal region. The liver channel wraps around the genitals. As we had seen with other transporting points on the liver channel, they all affect genitalia. Liv-4 is effective for testicular retraction and orchitis, that's inflammation of the testicle. Liv-4 also treats various kinds of seminal emissions. The liver rules the ministral fire, xiang huo, and the kidneys rule the fire at the gate of vitality, Ming Man. Sexual desire manifests the fire of both the kidneys and the liver. However, the free flow of liver qi dominates the erection and ejaculatory function in men. Liv-4 is the point of choice to secure the essence gate. The essence gate, or Jing Guan, is the barrier that regulates the discharge of semen. We have a mention of the Jing Guan, I believe in 36th chapter of the classic of difficulties, the Nanjing. So when it comes to pathology, liver fire, damp heat in the liver channel, or liver and kidney yin deficiency, that's deficient fire, may agitate and disturb the essence gate, the Jing Guan, and lead to seminal emission. Liv-4 treats any kind of seminal emission, including seminal emission due to heat, seminal emission at night, and seminal emission due to deficiency fire. We can needle this point, and we can also apply moxa to this point to treat deficient type of seminal emissions. Now, normal excretion of urine depends mainly on the bladder channel, which represents by kidney yang. However, stagnation of qi in the liver channel, heat due to qi stagnation, or damp heat in the liver and gallbladder channels can cause painful urination. Damp heat in the liver channel can cause difficult or painful urination. Liv-4 treats these conditions. It is also an effective point in case of acute colics when a patient is passing the kidney stones. Liver qi stagnation can affect the intestines. Liv-4 spreads liver qi in the umbilical region and lower abdomen. It can treat pain and swelling in the umbilical area, hernias, discomfort after eating, and difficulty in defecating. For periumbilical, that is around the navel pain, we can use Liv-4, Zhēng 9, and Zhēng 8. Obviously, Zhēng 8 is the navel, and so we are not applying needling. To this point, we use moxa only. And for the pain in the umbilical region, another combination would be Liv-4, Liv-8, that's the He of the liver channel, Zhēng 9, just like in the previous combination. And finally, for drum distension, we can use Liv-4, kidney 7, a metal point on the kidney channel, spleen 4, the low point, spleen 3, the true earth point, and again, Zhēng 9. As you can see, all three combinations that involve some bloating or abdominal pain use Zhēng 9, a point 1 cun anterior to the umbilicus. This point works well for water retention and bloating due to qi stagnation in the intestines. Zhēng 9 is contraindicated in pregnancy. In case of water retention, do not needle but moxa this point. Liv-4 can also disperse liver qi in the chest. One of the classical indications of Liv-4 is that it treats sighing. The liver channel ascends along the neck and the throat to the nasopharynx. Swelling of the throat with inability to swallow can be treated with Liv-4, small intestine 2, and kidney 6. We know that kidney 6 is a very common point to treat throat issues. And for esophageal constriction, we can choose Liv-4 in combination with bladder 44. Finally, Liv-4 treats inversion counterflow of the feet. In this condition, qi constraint in the torso does not allow for the circulation of qi to the extremities. As a result, the extremities become weak and cold. And for difficulty walking, we can moxa or needle Liv-4 Liv-4, a source point on the liver channel, and stomach 36, the true earth and Hexagram point on the stomach channel. One of the clinical presentations of this type of counterflow, I believe, is chronic sciatic pain and weakness in the leg, or weakness in the leg due to disc herniation. So when we discussed Liv-4 point, we spoke about this point's ability to treat sciatic pain. Liv-4 is yet another point to treat pain and potential nerve damage, especially in the gluteal region, because remember that the ankle joint has a holographic correspondence with the hip joint. In terms of the liver channel relationship with the other channels, liver channel has the following correspondences. It has a husband-wife relationship with the gallbladder channel, that is a yin-yang relationship. With the pericardium channel, it is paired as zhōng-yin channel. With the large intestine channel, it has an extraordinary connection. With the small intestine channel, it connects by the midday rule. And finally, with the lung channel, it connects as an adjacent channel in the 24-hour qi flow cycle. And these connections have the following clinical implications. In my practice, I use Liv-4 routinely to treat acute and chronic neck pain because of the holographic correspondence of the ankle joint to the neck region. The liver channel treats pain in the gallbladder and small intestine channels on the opposite side. I also needle kidney 4 on the opposite side because the kidney channel balances the bladder and Sanjiao channels on the opposite side. The same principle would apply to the treatment of the wrist, elbow, or shoulder joint. On the arm, the liver channel would treat the lung, large intestine, pericardium, and small intestine channels. We would also add kidney channel point to treat the Sanjiao and the heart channels. Well, this covers all that I wanted to say about the point Liv-4, zhōng fēng. I hope this was helpful. If you have any questions or comments, please don't hesitate to post in the comment section. I've been your host, Andrei Yorshov. Thank you so much for watching, and I will see you next time.